Om Swastiastu, we are from SGD B2. Today we are going to present our student project presentations entitled Conjunctivitis while traveling. But first, let me introduce our team. And here is the outline for our presentations today. Before I start the presentation, let me introduce myself. My name is Jenny Sujaya, with the last 3 digits of student number is 037. Now let me start the presentations with the introduction of this paper. Starts from the background. Conjunctiva lines in the front surface of the eye. It serves as protective barrier and provides lubrications in the eye by producing tears and mucus. The conjunctiva can be inflamed and will result in redness of the eye, which is known as conjunctivitis. Conjunctivitis can be found in various ages, which make it a very common cases encountered in primary care or ophthalmologist care around the world. The conjunctivitis treatment can be various based on the etiology, chronicity, and disease severity. Destinations, climatic, and hygiene conditions can promote conjunctivitis in travelers while they are traveling. Therefore, travelers need to understand the destination's condition and factors that will promote the conditions to prevent conjunctivitis from happening to them. So here is the problem formulations for this student project. And here is the purpose of this student project writing. And also, here is the benefits. The benefits of the student project for medical students includes understanding the definitions, the epidemiology, etiology, pathophysiology of conjunctivitis, understanding the relations between travel and conjunctivitis, and to understand the current treatment and prevention for conjunctivitis. The benefit for community is to increase understanding and awareness in eye health during travel. That's all from me. The next part will be explained by my friend. Thank you.
My name is Josephine Load. The last 3 digits of ID number is 094. Definition of conjunctivitis. Conjunctivitis is an inflammation of conjunctival tissue accompanied by swelling of the blood vessel, discharge in eye, and pain. The conjunctiva itself is the clear lining that are in the eye. Swelling of the blood vessels make them more visible and make the eye appears reddish or pink. Conjunctivitis, also known as pink eye. That's all from me. Thank you.
My name is Diana Ningrum and I will explain about the epidemiology. The incidence of conjunctivitis is one of the most common causes for coming to clinics. Acute conjunctivitis occurs worldwide and is reported to be diagnosed in over 80% of non-ophthalmological medical doctors. And the incidence of conjunctivitis worldwide has increased, but this greatly depending on the region of each country. This can be reflection that the nature of conjunctivitis is very heterogeneous. The highest prevalence of conjunctivitis according to the data, especially for allergic conjunctiva, is known to be in Asia, with Japan being a hotspot of high prevalence. Nearly 60% of patients with acute conjunctivitis have antibiotic eye drop treatment administered by a non-ophthalmologist in the majority of cases. In Indonesia, the treatment of conjunctivitis is generic and patent antibiotics, and the use of generic antibiotic in Indonesia has increased by up to 70%, with patent drugs are still found.
My name is Prasanya Trikila, with the last 3 years of student ID number is 199, and today I will talk about the etiology of conjunctivitis. The causes of conjunctivitis can be divided into two, infectious and non-infectious. The infectious one is divided into viral conjunctivitis and bacterial. Viral conjunctivitis is caused by viruses, and the most common one is adenovirus, and this type of conjunctivitis is highly contagious and can cause outbreaks. The second one is bacterial conjunctivitis and is caused by bacteria such as Staphylococcus aureus, and it is more common in children than adults. The non-infectious one is divided into two, allergic and conjunctivitis that caused by irritants. Allergic conjunctivitis occurs due to the body's reaction to allergens such as molds, medicine, cosmetics, dust mites, and pollen. The conjunctivitis that caused by irritants is caused by the body's contact with chemicals, dust, smoke, and vapors. Thank you.
Hello everyone, my name is An Agung Istriandini. With my last 3-digit register number is 233. Now I will explain about the pathophysiology of conjunctivitis. The most common type of conjunctivitis is due to bacteria, viral, and allergic infection. The first one is conjunctivitis due to bacteria. Conjunctivitis caused by bacteria is usually caused by Haemophilus influenza, Streptococcus pneumonia, and Moxacella catarrhalis. And next one is conjunctivitis due to virus. Conjunctivitis caused by virus is usually caused by an adenovirus. In children, it is usually more dominant to get conjunctivitis through a viral infection compared to adults. And for the next explanation will be explained by my friend. Thank you.
My name is Kedara Jaya with the last digit of my student ID is 075, and I would like to continue the explanation from my college. The transmission of conjunctivitis can be through several routes, namely through hand-to-eye contact, contact with vomits, through droplets, and can also be through reservoirs such as swimming pools. And for the conjunctivitis due to allergies, it is an inflammation type disease that occurs due to a hypersensitivity reaction by a type 1 immunoglobulin E and degranulation of mast cell due to direct contact of allergen with the eye surface. And this disease, allergic conjunctivitis, is divided to several subtypes, namely seasonal and perennial, vernal, atopic, and giant papillate.
My name is Stella Angeline Isvianto and my last three digits are 142, and now I will present about the risk factor of travel-related conjunctivitis. So the first one is viral infections and bacterial infections that are prevalent to tropical or subtropical destinations such as chikungunya and Zika virus infection. And the next one is allergic inflammation caused by allergens or foreign substances such as pollens. And then the next one is irritation caused by irritants from a foreign body in the eye or contact with smoke, dust, or chemicals. And then the next one is wearing contact lenses longer than recommended, also becoming a risk factor of conjunctivitis. And then the last one is poor hygiene, such as touching the eye without washing hands.
Hello everyone, my name is Grace Valerie with the last 3 digits student number of 143, and in this presentation I'm going to present about the clinical manifestations of conjunctivitis. So there are two common clinical manifestations, which are redness and discharge, and there are also common but non-specific manifestations, which are itching, watery discharge, atopy history, papillae, as well as follicles. There are three most common types of conjunctivitis, which are bacterial, viral, and allergic, and the difference between the three depends on the type of discharge, occurrence of pre-auricular lymphadenopathy, as well as other non-specific manifestations. That's all from me. Thank you.
Hello doctors and friends, my name is Sisi Natalia with the 3 last digit student number 109. Now I'm going to present about the treatment of conjunctivitis. So the pharmacological interventions are not necessarily needed because some cases can heal in a few weeks without treatment. However, the pharmacological intervention usually aim to reduce the infection rate and to ease the symptoms, especially in the case of bacterial and viral conjunctivitis. The types of intervention including eye drops and ointments, antibiotical, or histamine according to the types of conjunctivitis. The further explanation are written on the paper, and the rest is gonna be explained by my friend Gwen. That's all from me. Thank you.
Hi, my name is Gwen Felshadan with student number 110, and I'm going to continue discussing about the treatment. So for allergic conjunctivitis, patient can be intervened with avoidance of allergens, artificial tears, cold compresses, and also various topical agents such as topical antihistamines, vasoconstrictors, topical mast cell inhibitors, and also topical glucocorticoids. Oral antihistamines can also be used for moderate or severe allergic conjunctivitis. Patients with moderate or severe pain and also other complications should be referred immediately to an ophthalmologist, such as loss of vision, corneal lesions, and profuse purulent discharge. That's it from me. Thank you for listening.
First, let me introduce myself. My name is Danisa Putridita with the last digit number 005, and today I'll present about the prognosis of conjunctivitis in travelers. So the prognosis of conjunctivitis are based on the etiology, and the first one are prognosis of bacterial conjunctivitis. So the prognosis are highly favorable because this conjunctivitis can have spontaneous cure within 1 to 2 weeks, while if it's being treated properly, it can be cured within 1 to 3 days. And for the viral conjunctivitis, the prognosis are also highly favorable. Why? Because viral conjunctivitis severity may be usually increased within 4 to 5 days, but it will resolve by itself for the following 1 to 2 weeks. And the last one are allergic conjunctivitis, and the prognosis for this conjunctivitis are also highly favorable as long as the patient get immediate proper treatment for the allergic. But still, for the allergic conjunctivitis, recurrence are common unless the antigen being eliminated. So that's all for me. Thank you.
Hello, my name is Dea Kalistandana Putri with 3 last digit number 129, and I will present you about the prevention of conjunctivitis while traveling. To prevent the transmission of conjunctivitis while traveling, the key is maintaining our personal hygiene, such as wash hands frequently, wash hands after contact with an infected person or items he or she uses, avoid touching or rubbing eyes with unwashed hands, do not share items used by an infected person, do not share eye cosmetics or anything that goes near eyes, clean, store, and replace after using contact lenses, try wearing goggles when swimming in a public pool with high chlorine levels. That's all from me, thank you.
My name is Evania Ecclesia, and the last 3 digits of my student ID number being 127. And these are the conclusions of our presentation. Conjunctivitis is an inflammation of conjunctiva, which is a lining tissue that surrounds the eyeball. Traveling to tropical and subtropical area is a risk factor for conjunctivitis. Conjunctivitis is a self-limiting disease, but giving antibiotic is recommended to improve symptoms. Good personal hygiene should be done on a daily basis, as it is the only way to prevent conjunctivitis.
So that's all about our presentations about conjunctivitis during traveling. We do apologize for any mistakes during the presentations. Thank you for your attention, and I'll close the presentations with Parame Santi. Om Santi 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 Om.